In this video, we're going to hear the story of Castor, a 24-year-old grad student who felt a lump in his balls, found out that it was testicular cancer and had to have them chopped off. We'll also tell you a lot of fun facts about the precious balls, so stay tuned. Hello my friend, welcome back to Chatterdocs. In this channel, we believe that learning about health does not have to be boring. So if you're new here, please consider subscribing to our channel and turning on the notification so you'll never miss anything. Today, Dr. Rina Malik is here with us in this video. She's a great urologist in Baltimore and she also has a great YouTube channel. So don't forget to visit that channel. I'm gonna put a link down below in the description. Make sure you subscribe to our channel for awesome videos on urology and also a lot of great reaction videos. Hi Rina, how are you?
Good, how are you? Thanks so much for having me on.
Good, absolutely, it's my pleasure. So tell us something about yourself outside the world of medicine.
Yeah, so I'm a mom, I have 2 kids, and I like to tell people that my superpower is that I'm super organized. So I always really keep track of everything I'm working on, and that helps me get get my goals accomplished.
The English word testicles is derived from the Latin word testis, which means witness. How did they come up with that? Well, English Romans had to lay their balls on the line when they swore to the truth or testified in court. Somehow, this seemed more serious than a handshake. Balls are often linked with bravery. In 1932, Ernest Hemingway, in his book on bullfighting, Death in the Afternoon, used the word cojones as a metaphor for bravery. It takes more cojones to be a sportsman when death is a closer party to the game. Cojones is a Spanish word for balls. Both the Greeks and Romans made the direct connection between testicles and courage. As it happens, there's also a contradiction in classical art associating heroic virtue, including courage, with small testicles, which implied self-control. But are balls really related to courage?
Yeah, so let me actually tell you a story I heard today. So I read on the internet today, someone sent me this really interesting article that the first organs that were trafficked in history that have been documented were not kidneys or hearts or lungs or anything like that. It was actually testicles. And the reason being that people, before they could get testosterone, replacement therapy, they wanted to get testosterone. So they would actually, use those testicles and implant them on other people. And there's a urologist in the early 1900s who actually took a cadaver testicle and implanted it on himself. And then he would go and talk to his colleagues about it. He also took mini testicular tissue and would implant it in different areas of the body. And in theory, it worked pretty well in boosting his testosterone. But I found that really interesting. So back to your question is, are balls really courageous? Well, balls or testicles are actually the 2 organs that are housed in the scrotum. And what they do is, in animal studies, they've been shown that they are really linked to aggression. So animals who have higher levels of testosterone are more aggressive. But in human studies, it's not so clear. What we have seen is that people that are about to go into competition tend to get higher levels of testosterone. And the theory behind that is they get ready for more risk-taking behaviors, more competitive advantage, have a little bit more focus and concentration, and it kind of clears their cognition. So there may be certainly some benefit to testosterone in a competitive format, but does it really give us courage? It's unclear.
Why are testicles hanging in a sack outside the body? Wouldn't this make them more exposed and prone to getting kicked?
Before I can explain that, I have to tell you a little bit about what the testicles do. So they have 2 main functions, and one is to produce sperm, which is essential for fertility or the ability to have children, or the other major function is to produce testosterone. And testosterone is a hormone that is produced by both men and women, and it has important value in producing sperm production, as well as genital growth, so having boys becoming men, and as well as a host of other things that are beneficial, including cognition, muscle mass, and those sorts of things. So it's an extremely important organ and it produces extremely important hormones. The reason it's outside of the male body is because in order to produce sperm, the optimal temperature is actually a couple degrees lower than the body temperature. And that's exactly why evolutionarily testicles are placed outside the body to help produce healthy, viable sperm.
Now let's hear a story of Castor. In January 2019, at age of 24, Castor was experiencing pain and swelling in his right testicle. He was at the school that day, and as the day went on, the pain got so bad he could barely tolerate it. The area was tender and enlarged, and he decided to go to the ER. Now tell us more about the testicular cancer. What are the risk factors and common symptoms?
Yeah, so testicular cancer is a cancer of actually young men, so more common in men ages 15 to 35. And typically it's found because there is a lump in the testicle. So people will present because they feel a mass or a hardness in their testicle. In more advanced cases, they can sometimes have back pain, they can have breast enlargement or tenderness, they can have issues in being kind of having poor cognition, which may be signs of brain disease or things like that. But very commonly nowadays, we're seeing it present with just a mass in the testicle. There's actually some risk factors for testicular cancer. And so one of them is having an undescended testicle at the time of birth. So if for some reason your testicles didn't descend, and what happens in embryology is that your testicles are actually formed inside your abdomen. And as you are going through the gestational period, meaning that you're in the womb of your mom, that those testicles start dropping down. And if for some reason something was inappropriately produced or something didn't get expressed during embryology, during that gestational period, you can have what's called undescended testicles, so ones that don't go all the way into the scrotum. So that's a risk factor for testicular cancer. Having a history of testicular cancer in your other testicle can also put you at risk for getting testicular cancer a second time in the other testicle.
Question: do testicle injuries increase your risk for testicular cancer?
So luckily not. It has not been shown in any studies to actually increase the risk of testicular cancer. There is, however, people who will identify a lump in the testicle after they've gotten hit because they may not be checking or doing self-examinations. And so after they get hit, they're like, hey, I now feel this lump. So they kind of have this thought that maybe getting hit was what caused it, but that's not actually true.
Let's get back to Castor's story. In the hospital, they did an ultrasound and they brought down a urologist and an oncologist who was fairly certain it was cancer. Now, Rina, what are the diagnostic tests that we do for testicular cancer?
So as far as testicular cancer is concerned, it's a little bit different than other cancers. All we do is typically a testicular ultrasound to identify the mass. And testicular masses have a very characteristic appearance. So very often we can say with a degree of certainty that it is likely testicular cancer. And so we then go on to treat that testicular cancer with an orchiectomy or removal of the testicle. If there's any question, you can do a testicular biopsy, but it's not recommended in testicular cancer because actually doing the biopsy itself can cause seeding of the cancer, which means that cancer can then spread to the skin of the scrotum, which makes it more challenging to treat if it is truly testicular cancer.
Castor found out about his cancer when he felt a lump. What is the role of self-examination in diagnosing testicular cancer?
So a self-examination is essentially when you yourself examine or feel the testicle. So what we recommend is you hold the testicle kind of between your first finger and your thumb, and you feel both sides of it and around all sides of it. You will feel on the back side what's called an epididymis, or like a cord-like structure, and that's normally supposed to be there. You want to do this once a month, typically after a warm shower, so that the testicles are kind of down and in the scrotum, and you're not cold and they don't kind of go up, and that happens because you have a muscle that pulls them up when you're cold. And you want to do this and kind of get to know what your normal testicle feels like. It really doesn't require a lot of time or a lot of energy. You just do it really quickly once a month, and it might save your life.
Now back to Castor's story. A few weeks later, they removed the affected testicles and discovered through additional testing that the cancer had spread to his chest and abdomen. He underwent chemotherapy and radiation afterwards. Rina, what are the treatments for testicular cancer?
So as I mentioned earlier, the first treatment is surgical, or removal of the testicle, and that's called an orchiectomy. After removal of the testicle, the pathologists are partners who look under a microscope to see exactly what kind of cancer it is, and then then you get some imaging to determine if that cancer has spread or if you have any lymph nodes or things like that. Basically, depending on the type of cancer you have and the spread of the cancer will determine if you need further treatment or not. And the treatment can range from needing radiation or chemotherapy.
Fun fact, one of your balls is bigger, just like boobs, and it's also hanging lower than the other, typically the left one. The reason is because the already tight real estate between your legs would be pretty uncomfortable if your balls were situated side by side symmetrically. It makes sense that the male body is designed in a way that keeps these two key parts of the anatomy from crushing each other. Also, it gives your wee-wee some room to lay on the side with the lower ball. Some experts also say that it's because regulating the temperature of one ball wouldn't affect the other one. Rina, what happens after taking out one or both testicles? Does the sex drive diminish? And is there any treatments for that?
Yeah, so if you remove one testicle, the other testicle should still be able to produce testosterone, which would then allow you to have a normal sex drive. If you remove both testicles, then your testosterone production would reduce significantly, in which case your sex drive would be affected. And in that case, you can get testosterone replacement therapy to help with increasing that sex drive back to a normal level.
So what about fertility? Does that get affected as well?
So after, again, removing one testicle, you should still be able to father children because you'll have normal semen parameters and semen production from that one testicle. However, if you're gonna undergo radiation or chemotherapy, that can affect the sperm parameters of your remaining testicles. So it's important to always discuss sperm banking, even if you're just removing one testicle, before you undergo further treatments for testicular cancer, because you never know if you are gonna wanna father children and if you might have issues down the road, this could really save you.
All right, so taking out testicles could be emotionally traumatizing as well for men. Any suggestions for how to cope with that?
Yeah, absolutely. It really can be extremely stressful and distressing for men to have to go through that and then go through additional therapies if needed. So, you know, there's a lot of support groups available for men who've undergone orchiectomy or loss of a testicle. It's also important if you're feeling depressed or anxious to seek help from a psychiatrist or psychologist in your area, because it can be really helpful, and it's not a weakness to seek help and get help for your mental health as well.
Thank you so much, Rina, for all the great information. If you guys enjoyed this video, please smash that like button. Also, please visit Dr. Rina Malik's awesome YouTube channel and subscribe to her channel as well. The link is down below in the description. Biddy daddy daddy dodo. Shit. Problem is I'm so sober. Vase paintings and sculptures sometimes depict mythological. Don't forget to subscribe to my channel. Also, if you have any questions about testicular cancer, ask below in the descriptions and we will answer you as soon as possible. Thanks for watching, and I'll see you next week.